All right, so have you ever gotten that weird, like, metallic taste in your mouth?
Yeah,
It's like,
yeah,
whoa, what is that happening?
yeah.
Like, I remember once I was eating a salad, and it was like all of a sudden, like a hardware store just kind of like,
Like you just licked a wrench or something.
exactly.
Yeah.
So we're doing a deep dive on this today. We're figuring out what's the reason that this happens and what we can do about it.
Yeah, it's called dysgeusia, just so you know, like the
Well,
official fancy name. And it's usually harmless, but it can be a symptom of other things going on
interest?
in your body, which is kind of what we're going to get into.
Okay, so it's not just your mouth being weird. It could be a sign.
Could be a time.
Okay,
Yeah.
so
Hmm.
first things first, let's just address the elephant in the room. Could it be bad oral hygiene?
Sometimes, like if you are really neglecting taking care of your mouth, that can definitely cause like a metallic taste because you could have gum disease, you could have an
Like
infection.
your mouth is just like, please help me
Right.
with a metallic taste.
Exactly.
Okay, well, what about if you, like, you're a good brusher, you're a good flosser, you're doing all the things, and you're still getting it? What's up with that?
Well, that's when it gets a little bit more interesting and we can look a little bit deeper because it could be medications you're taking. Yeah, even vitamins.
You're kidding. My vitamins are attacking me.
They could be. They could be. It all has to do with how your body processes certain compounds. And sometimes, they have heavy metals in them.
Oh, interesting.
And so if your body's not absorbing them properly or if there's just an excess, it can create that metallic taste.
Okay, so is it kind of like I've had too much of this vitamin, I need to chill out?
It could be. It could be.
Interesting.
Yeah.
What about prescription medications?
Yeah, there's a lot of those that can cause it. Antibiotics are a big one. Some blood pressure medications,
Wow.
medications for gout. And it's not necessarily that the medicine itself is what's causing the metallic taste, but it's the way that it's interacting with your body's chemistry.
Oh, so it's changing something.
Yeah,
Interesting. So it's like our taste buds are way more connected to everything else that's going on than we realize.
right. Exactly. It's all related.
So when should we actually be concerned?
That's a good question. Most of the time, if it's just a fleeting thing, it's probably fine. But like if it's really persistent or if it's sticking around and you're having other symptoms too, that's definitely a good time to chat with your doctor about it because it could be something more.
Like a little, hey, pay attention to me.
Yeah, like a little
Yeah.
sign.
Okay.
Yeah. And sometimes, our bodies go through these big changes, right?
Right.
And those can make our taste buds go a little bit haywire. Like pregnancy is a big one.
Oh, yeah. Pregnancy is notorious for like messing with your sense of taste, right?
Exactly, exactly. And so, all those hormones are shifting and changing, and that can definitely cause a metallic taste. A lot of women experience that, especially in the first trimester.
So they're not imagining it. It's actually a thing.
It's a real thing. Yeah. And then, there are some other medical situations where it can be a side effect, like some cancer treatments.
Right. Yeah. With chemo, that's definitely something that people experience.
Exactly.
And I mean, obviously, the benefits of going through those life-saving treatments far outweigh the side effects.
For sure.
But it's still good to know what those are and kind of how to manage them.
Right. And there's actually been some research that shows that zinc and vitamin D may be helpful in reducing that metallic taste that some people experience with cancer treatments.
Really?
Yeah. Still more research to be done,
Okay.
but that's promising.
Yeah, that is promising, but also always check with your doctor first
Of course. Yeah.
before you just start, like, adding a bunch of supplements.
Right. Exactly.
Good.
They know it's up.
Okay. So we've talked about, like, what's going on inside the body, but can anything in our environment trigger this weird taste?
That's a really good question. And you're right. Sometimes it's not just what's happening internally, it can be external factors too.
Okay.
And it is true that exposure to certain chemicals can cause that metallic taste in your mouth.
Oh, interesting.
So that's something to be mindful of as well.
Okay. Well, that brings us to, like, okay, if we've got this taste in our mouth, how do we get rid of it? Because it's so strange.
Yeah.
Like, I just want this to go away.
Exactly. And luckily, there are some things you can do.
Okay, give it to me.
Okay. So one is oil pulling. Have you ever heard of that?
For metallic taste?
Hmm.
Not really.
Yeah. So
Yeah.
basically, you swish coconut oil around in your mouth for like 20 minutes a day.
20 minutes?
I know it sounds like a long time,
Okay.
but it can be really helpful in just kind of like balancing things out in there.
Interesting.
Yeah.
Okay. What else?
Another one, this might sound kind of weird, but you can make like a paste out of cinnamon and honey,
Okay.
and you just put that on your tongue for like 10 minutes, twice a day.
That sounds delicious.
It does.
So even if it doesn't work, at least I'm having a snack.
There you go.
Right. Cinnamon and honey, two great tastes that taste great together.
Exactly. And a lot of these remedies are really about trying to like balance out the pH in your mouth
Okay.
or like the bacteria that's in there. So like another one is rinsing with baking soda.
Oh, interesting.
Yeah, baking soda and water,
Mhm.
because that can neutralize the acidity, which might be contributing to that metallic taste.
So it's kind of like we're becoming our own little scientists in the kitchen, just like experimenting with different things to see what works.
Yeah, a little bit.
I like it. Okay, what else?
Um, well, sometimes, honestly, just like changing what you're drinking can make a difference.
Oh, okay.
Like if you're prone to getting a metallic taste, maybe swap out your mineral water bottle for like a glass of water with lemon.
That makes sense, yeah, because metal water bottles are great. But
Yeah.
if you're already tasting metal, it's probably not going to help.
Probably not the best idea.
It's so interesting, though, how much we've learned about, like, one weird taste
Right.
and what it could possibly mean.
It's really fascinating.
It really is.
Yeah, and it just kind of shows you that like your body's always sending you these little signals.
It is.
And if something tastes off, it might be a sign that something else is going on. So yeah, pay attention to those things.
Pay attention.
Yeah.
I like that as like a takeaway from this deep dive is like, even if it seems small,
Yeah.
your body's trying to tell you something, so listen to it.
Exactly. Exactly. And you know, if you try some of these things and it's still sticking around, definitely go talk to your doctor because
Of course, yeah.
they'll be able to figure out if it's something more serious or if there are other things you can do.
Absolutely. Your doctor is your friend in this case.
Yes, always.
Well, this was super interesting. And it honestly, it kind of makes me think, if our sense of taste is so connected to our overall health, what about our other senses?
Oh, that's a good question.
Right. Like,
Yeah.
what other things are we missing out on by not paying attention to what we're feeling and smelling and all of that?
Yeah, that's something to think about.
It is something to think about. And you know what, listeners? We would love to hear from you. Have you had that weird metallic taste? What did you do about it? Let us know, because maybe we'll feature it in an upcoming episode. Until then, we'll catch you next time.